This patient was referred to me for endodontic treatment of tooth number 29. As you can see, large decay approximating the pulp. So patient was also complaining of pain to hot and cold and biting on the tooth. As you can see, old amalgam fill, and that part of the amalgam is actually completely fractured off and loose and stuck between, wedged in between 29 and 30. So I've talked to you guys about being thorough, not having a tunnel vision where you only focus on one tooth. So if you can look at this radiograph here, you can see that tooth number 29 has a previous root canal, short fill here, and it looks like maybe a periapical lucency. So I investigated a little bit more. See, these people, patients come to us, trust in us. They put their health into our hands, right? So we really need to treat them well and be thorough. So I asked the patient, I said, I know you're here for this tooth, and this tooth is very obvious, you're gonna need a root canal, but tell me a little bit about this tooth here, the very last tooth on the lower right side. When was the root canal done? The patient said the root canal was done about 5 years ago. I said, does the tooth bother you? Does it hurt? Has the tooth ever hurt or ever bothered you? And the patient said no. So percussion within normal limits, palpation within normal limits, probings 2 to 3 millimeters. But again, you can see the radiograph perhaps looks like maybe there's a periapical lucency there. That's another angulation of the tooth. Maybe there's something going on here. Again, this x-ray, you can see how short that fill is. Again, short fills don't matter if we don't have anything going on here, but in this case, that's a possibility with the short fill. When I see a short fill like that and something like that, there is a possibility. I'm not saying 100%, but there is a possibility that this may be something that we need to keep an eye on. All right, so because patient has had no symptoms, no issues with the tooth for the past 5 years, ever since the root canal, basically. So I told the patient, I said, just have your dentist keep an eye on it, or come back and see me. If anything changes here, if you start to have issues with the tooth now bothers you, it hurts sometimes, maybe all the time, maybe now it starts to bother you when you bite down on the tooth, and documented that in the patient's chart notes. And then when I wrote the reports for tooth number 29, on the report to tooth number 29, I advised the dentist to please keep an eye on tooth number 31. Okay? All right, so back to number 29. So today went ahead and did this root canal for the patient in one appointment. Rubber dam, of course. Removed all this decay, rebuilt that distal wall temporarily. I used duotemp in some cases. In this case, I used duotemp. This tooth will need a crown lengthening. I put that in the patient's report to the dentist because decay was subgingival. So take a look. One canal system. Everything went beautifully. And here it is. Everything went great. As you can see, we went ahead and temporized the tooth and referred the patient back to our dentist for the permanent restoration. Of course, crown lengthening, build up, and then permanent restoration, which is a crown in this case. But again, you can see number 31. There's definitely something going on there. Maybe there's something going on, maybe isn't. The dentist will keep an eye on it. Now, she knows.